It is such an opportunity to be here with 4 leaders who recognize that civic leadership is a key aspect of community health. And that makes the Kansas City metro area really a unique one for promoting well-being. You all answered your poll questions earlier, and we have representatives, physicians from Missouri, from Kansas, and who serve either both sides of the state line or live in one and serve the other. So they care for the constituents of our 4 mayors here, but I don't know that all of the physicians have a good appreciation for the health successes in your individual communities. So I thought we would start with our first question. Each one of you get a chance to answer that. And we'll start with Mayor Dunn. And the question is just, can you talk about a win in your community related to health? Mayor Dunn.
Well, I do have a win in mind, but before I say that, I want to thank you, Dr. McCandless and Dr. Potts, for helping us get Tobacco 21 passed in the city of Leawood. And that was a couple of years ago, and I really appreciate it. I know you came to a number of our meetings, Dr. McCandless, and appreciated your advocacy and support. But the other win I really wanted to mention is our co-responder program. We actually started that in 2016, and we were sharing that with 9 other cities, the co-responder, working with the Johnson County Mental Health Department. In 2018, we decided we needed our own with Prairie Village and Mission Hills. So we have one co-responder who works just with those 3 cities, and I think Leawood uses her the most. Just since 2019, when she came to work for our 3 cities, she's worked with over 650 individuals, and she's kept numerous people from going to emergency rooms, as well as some going to jail, and reduce the 911 call load tremendously. And she does follow-up reviews with family members and has just done a remarkable job helping people navigate the mental health capacity and agencies and facilities needed and of use if you know how to navigate.
And I know that Leawood has also set up free gun locks that you can get at your local police station. You've done DEA drug takebacks. So it's been a variety of opportunities in Leawood to think about health broadly. So congratulations and thank you, Mayor Dunn. Mayor Alvey, would you tell us about a win in KCK Wyandotte area?
Thank you. What I would like to really focus on is our response to COVID, because again, when this first hit, there was so much unknown about it. What we did know about it gave us good reason to fear. What we did not know about it and where it might go gave us even more reason to fear. And so it was very important to bring people together in collaborative conversation on a consistent basis. So the first thing we did is we convened a group of institutional leaders from across Wyandotte County, bringing together our public health department, our medical director, our emergency management, our administration, plus the leaders of educational institutions, our mental health providers, social work providers, anyone who had real direct contact with the public and who was going to be in a position to make very serious decisions about how to work through the pandemic. We came together on a daily basis to get updates. And so what was important about that is the information that the medical directors, public health directors were able to bring to us, the anchor institutions in the city were able to access that information immediately every day. They could then disseminate it to their organizations, and they could bring questions and concerns back to that group every day. And so it really allowed us to get our arms as much as we could around the virus. And perhaps the biggest win, I think, is that we allowed directors and the doctors to take the lead on this, to say, we will not politicize this. We want our public health directors, our doctors to lead us in this, show us where we are with this. The fundamental of this is it's a virus, and we have to understand what this virus is, what it does, and where it might take us if we don't control it. And given that, then these are the kinds of measures we need to take. And so because there was that collaborative consensus, I believe we have really been able to keep the politics pretty much out of it. Though more recently we began to see, at least from our school districts, some questioning and some doubting and some pushback and asking for more relaxation, even though the numbers show that that may not be advisable at this point.
I know that that's been a challenge for every mayor here, and you have been using your public health people to the best effect. I also want to highlight a couple of things in Mayor Alvey's area. I know that you have brought the Merck Co-op, which is a grocery store, to an area that's been a food desert for many years. You've invested very much in a walkable downtown, really trying to think about how you keep people active and well. So appreciate your work in promoting community health there. Mayor Weir, would you like to talk about something to celebrate in my good hometown of Independence?
Yes, thank you very much. And I just want to take one moment and congratulate Dr. Potts on a very well-deserved award. And also to Mayor Potts as well for your incredible support for public health initiatives during your entire marriage and courtship, I know. And certainly two people who are great mentors to me, both personally and professionally. So we wish you all the best from Independence. So I certainly will be chastised by the Pottses if I don't mention all of the efforts regarding smoking cessation and certainly Tobacco 21. And Dr. Potts, as well as you, Dr. McCandless, have just been tremendous advocates in our city for that, as well as the clean indoor legislation that was passed by the voters to bring clean air, indoor air to Independence many years ago. And those were very significant efforts. And Independence was truly leaders on both of those issues, putting in the indoor smoking prohibitions and really being the first city in Jackson County to support Tobacco 21. I will say, thinking about the Pottses this evening, certainly in areas of domestic violence, when Mayor Potts was in office, she recognized this as a problem and is the helped to found Hope House and create that service for our community, which did not exist, and knew that many women and children and families were suffering from domestic violence and had no place to go. So Independence under Mayor Potts's leadership was a true leader in that regard as well. Mayor Alvey, you've done just an incredible job with COVID, and my hat is off to you. What I thought about when this question was posed, Independence, I feel, has really been always a leader in public health in a variety of ways, everything from utilities, conservation, protection of our environment. But I really think that one of the things that we've done that is so significant is our investment in transportation. We are one of the few communities that makes a significant investment in a transportation system within our city. And the reason we do that is to provide people with access to education and healthcare, and employment, but primarily to education and healthcare. And I believe absent that, we would not have the health outcomes that we have in our city, and we certainly have many more that we would like to achieve. But being home to Centerpoint Medical Center, Children's Mercy Hospital, and many clinics around our city, providing that transportation to get people to those healthcare facilities, I think is something that we prioritized as a community many years ago. We invest in it heavily. we would love to expand that investment, but truly I feel that that is probably one of the most important things that we have done for public health is providing that transportation. And 2 years ago, I guess, we made a decision to put free public Wi-Fi on all of our buses, which in this age is certainly more important than ever. And we knew that people who had no internet access anyplace else, most of our families in the Independence, Fort Osage, Blue Springs, and Raytown school districts that serve independent, at least one person in their family has a smartphone, so they can get on the bus and they can access that public Wi-Fi.
Well, thank you. And I know that Independence has been a great champion for Medicaid expansion and for the prescription drug monitoring bill, which we have not quite finished up with, but we appreciate that that the county has joined into the consortium. So at least we've got coverage, even though it isn't whole state at this point. Mayor Lucas, could I ask you to speak to what you think are some wins for health in the great city of Kansas City?
Well, it is an honor to be with everyone today, and I have enjoyed the ceremony. I want to give a special shout out to my friend, Dr. Ted Higgins, who has done amazing work in Kansas City for many years. So congratulations. I also see on the Zoom my friend, Dr. Weir. I spent far much more time with him than I ever would as mayor. In my 14 months as mayor, we spent about the last 6 looking at a number of different things. I could say a lot about COVID. Indeed, I think most of the mayors on this line could probably write a book about it, as could many of you. But I will talk actually about public safety, because in some ways, the work that we do and the work that Dr. Archer has done to talk about prevention, intervention, ways to try to fight homicides and violent crime that isn't necessarily just through an enforcement prison, I think has been transformative in how we address issues in Kansas City. We certainly recognize that we have more challenges than we would like, and this year has presented more challenges in some ways than we think we can handle. But that having that level of balance, having that level of discussion on things like Aim for Peace, on things like making sure that the health department is working with all of our departments, healthy homes, et cetera, to make sure that we're building better lives and outcomes for Kansas Cityans is something that I think has been nothing short of amazing. It's transformative. And frankly, the involvement that our health department has had in issues ranging from housing policy to criminal justice policy to economic development policy has been something I'm very proud of, in saying that the root causes of violent crime are an issue that we actually have to address. I won't give a whole speech on violent crime, but I will note this. I was looking at statistics today. In just about every year of my life, except for 7 of them, Kansas City has had above 100 homicides. And so while we've continued to largely do the same thing in certain areas like enforcement, what we haven't done is always look to root cause type issues. I'm proud of the fact that the health department has been a leader in that. I'm proud of things like zero fare transit that relate to it, our healthy homes policy, as I've mentioned before. And I think there is more outstanding work that we can do. So I think that is a win, even if you don't see the results immediately. As we all know, it takes some time for these things, but it doesn't mean we'll give up.
And Kansas City is to be commended as one of the Culture of Health Prize winners, and has really taken an expansive view of health and is doing some of the probably premier work in the country, thinking about how neighborhood revitalization, how healthy housing policies all lead to health. And you know, housing is one of those silent ones that people don't think about as a health indicator, but Kansas City really is on the forefront of thinking about that because it has such implications. So the Kansas City Medical Society, as was mentioned earlier, has been diligently working on Medicaid expansion. And this passed in Missouri with an 86,000 person margin on August 4th. We are now in the implementation phase. And Mayor Lucas, this is going to have a big impact on Kansas City. And what do you see happening next regarding Medicaid expansion in your community?
You know, a few different things. I'm watching the next election like a lot of other people. I know Mayor Weir is as well. And by the way, if there are any state senators or state representatives on this line, I love you, regardless of your party. I think we continue to have some work left to do in Jefferson City. regardless of how the vote went. Lots of rulemaking efforts. But I think this is clear that Kansas Cityans, that Missourians broadly have supported Medicaid expansion, that I think people want us to see it implemented. And I hope that as we look at those steps of implementation, not just the governor did just call a special session today, but also when we get our new legislative session in January, that we're able to take real concrete steps in what the rollout looks like. An important part for all of us and everyone who's on this line is to say, how can we make sure that folks actually understand some of the changes that are occurring in Missouri? As we all know, from both Tobacco 21 to every effort we've ever taken, it's not so much just getting that thing that you've chased so long, but it's making sure people understand the opportunity is there. There are so many people that kind of think, I can't go for certain services. I don't have access to this. I can't afford it. They see so many challenges. So I think there will be a huge, both political and lobbying effort to see where we get to next. But then there's also a significant communications effort that I think all of us in our jurisdictions will take a bold step in being part of.
Thank you. Now that we've talked about Kansas City, Missouri, our other Kansas City is without Medicaid expansion, and that leaves 36,000 folks in Wyandotte who don't have coverage. So Mayor Alvey, do you want to speak about Medicaid expansion or about the folks who are still seeking coverage, or how would you like to expound on that?
Well, I think it's important for us to again, what if there's one benefit that we are taking out of perhaps the COVID experience is a focus again on public health. And that when we look at health, it's certainly an individual decision, individual moves we have to make. But what we are seeing is it's a whole complex of factors, as Mayor Lucas mentioned regarding violence, what moves people, what leads them in a situation where violence is an option for them. It's what they do. And it's the same with health. All these social determinants of health have to be addressed. And even though we're not, I think, going to get to Medicare expansion this year, I do believe at some point it will, because I think the argument is going to become clear that you cannot afford to have a significant part of your population not able to access healthcare, not able to access jobs, not able to get a good education. That simply doesn't work. It's going to hold the region back if we continue to have large pockets of poverty in the region. If we could really invest in the poorest among us and really bring the services and the support, if we would just simply get to know a poor person and engage them in a way that actually helps them, it actually elevates everyone. So I think that the discussion about COVID has got to be public health. What does that look like? What is the common good here? And I believe that what COVID has done is expose some of the stress fractures in our body politic. And some of those things are frankly more than fractures now. They're getting worse, they're getting wider. But at the same time, it's an opportunity to see them for what they are and to address them much more cohesively and comprehensively. So certainly Medicaid expansion would be a tremendous help for us. 10,000 people would be able to access care immediately. We're putting a tremendous strain on our community health providers in terms of the reimbursements. And again, what we heard before COVID was a demand for workforce. Well, if your workforce cannot get to the jobs, cannot get the training for the jobs, aren't healthy enough to take on the jobs or sustain work, how is that going to work to grow the economy in Kansas City? So let's continue to look at this as a regional approach and understand that we must invest in every sector of our economy and every portion of our region, because insofar as we do that, everyone will grow. No one is going to get poorer if we invest in the poor.
Thank you, Mayor Alvey. My next question is for Mayors Dunn and Weir. One of the challenges that our healthcare system faces is a growing recognition and attention to mental health and well-being. And so Mayor Dunn and then Mayor Weir, could you speak to the challenges you see in your community and maybe some bright spots in the area of mental health?
Yes, thank you. As I mentioned before, our co-responder program has seen tremendous success. We've had one example I'll give you is a person who contacted the police department 8 times in a 4-month period. And when that sort of contact takes place, they go in and investigate living conditions and work with family members and figure out what the root cause of the issues are and get the person into the mental health system. And there was similar case that 12 contacts with the police over a 2-year period, someone else, that person had to end up going into a residential care facility. But I think knowing that there is an upswing in mental health issues throughout this COVID period especially, I think has made all of us aware. Suicides have gone up. Suicide is now one of the leading causes of death, both with youth and adults. And just a couple of years ago, we almost had an epidemic in our Blue Valley School District. We had so many teen suicides. So I think the more we become aware and more knowledgeable, the better off we'll be. And like Wyandotte County, Johnson County has worked closely with them. Actually, the Core 4 all work together. And I do think that we've taken COVID very seriously. And I saw the governor is once again expanding her mask requests throughout the state of Kansas. Right now, there's only 15 counties of 105 that are truly taking the wearing of masks seriously. So we're seeing upticks throughout the state where they're not doing that. So I want to say kudos to Mayor Alvey and certainly to Chairman Eilert, who's not on the call, but I think they've all worked with the mayors and tried to improve situations where we could.
Thank you. Mayor Weir.
Thank you. I think that we all see the results of lack of mental health services. I know Mayor Lucas and I certainly do in our communities with the number of people who are in crisis, who are on our streets, who are victims of crime, who sometimes are perpetrators of crime, children who are in very critical situations. We see that. And I really think that what we need to be focusing on, as we've been talking about, particularly crime, what are the root causes of these things that we observe? And certainly our citizens every single day are telling us, do something about this. Make this go away. We don't want to see this in our community. And I really do think, and I've seen it on your goals for the Kansas State Medical Society, is there just simply is not enough access. There's not enough service. There is, I mean, I have the best health coverage that money can buy as a public employee, public sector employee. And it's difficult to access behavioral health services. It's difficult to get an appointment. It's difficult to identify the right provider for you, your family, your children, the people that you love and care about. And so even people with all the resources just don't have the access that they need. And I just feel that we just don't have enough providers. And the demand is getting greater and greater and greater. I'm very proud of our society, and I want to say especially the youth in our society, that this is less and less something that people feel shamed about, and they want help. They want help. And there's simply just not enough help available at the right time. I feel that, you know, when my children were small, if they got a fever, I could take them to the urgent care. If my child is in crisis, where do you take them? There is no urgent care. Our police department has a very active crisis intervention team. Many of our officers are trained in crisis intervention, but there simply is no place to take people. So I think that that's a great need in certainly our region and everywhere, is that we need that mental health urgent care facilities. They, you know, we all know they end up either in jail or in the emergency room, and that's just not the place to deal with this type of crisis. Something bright, I think, a win, positive happening. There's a lot of peer support. There's a lot of peer support in our schools. There's a lot of peer support in our workplaces. I mean, I know as a city employee, we get 6 free mental health appointments a year. I mean, that's a benefit that is granted to all city employees, that if you just need somebody to talk to, we have that available to you. And I believe that people are taking advantage of that. And I do think, as Mayor Dunn said, that we are under trauma level stress as a nation and in our world because of this pandemic. And people are really understanding that, you know, you need to be able to have those types of services available. These are not things that we should be expected just to handle on our own. When your livelihood's been taken away, your sense of security is taken away, you're experiencing illness and death in your family, and the pressures of home with your children, trying to educate them, trying to keep everybody fed and safe is so overwhelming.
It is. Thank you very much, Mayor Weir. Our final question. The Kansas City Medical Society has 3,900 members, and we represent a spectrum of talent and interest and skills. And as a society, a medical society, we want to partner with you in our civic commitment to health. And so where do you see roles for physician leadership? We'll start with Mayor Lucas.
You know, absolutely. And I want to thank you all for all the leadership you've already given. Dr. McCandless, I got to know you when I was on the city council, and you're telling me how smart things I should do. Actually, I agreed with all of them. A few different ways to get engaged and involved. In Kansas City, we have almost too many boards and commissions. The mayor has responsibility of appointing about 900 people. I imagine it's calibrated, but there are a lot in all of our other jurisdictions that are represented here. Get involved and get engaged, even in areas where you don't think your expertise is germane to issues at bar. I think it is so important. And indeed, I've had a number of times where I've wanted to appoint medical professionals, doctors, other providers to any number of things. And so I would really love that. Email address is mayorq@kcmo.org. I've given my cell phone out to everybody already. That was a huge mistake. But nevertheless, I would love to hear from all of you, at least via email if it works. A few other areas, and then I'll get out of the way. You would be surprised about how much someone communicating about the issues that they're seeing each day make a difference. I had a conversation with a neurosurgeon at Research Medical Center not long ago about shootings, and he wanted to talk about violence and the young black men that he's treating all the time. And that was intriguing to me, and in some ways stirring, because the stories that you're taking on, the issues that you're seeing, are ones that we sometimes need other voices to share. Sometimes that I know certainly Mayor Alvey, Mayor Weir, Mayor Dunn, and I deal with is how do we get everybody to realize just how big and significant an issue that we're dealing with at a certain time. So whether it be gun violence, which is significant, whether it be suicides, as Mayor Dunn noted, which is incredibly significant for us now. Sometimes we need that amplifying voice, and we need to get to voices that are interacting with patients, with families, and others. And so making sure you're actually sharing those stories, that you can, of course, with us, the issues, the trends that you're seeing is incredibly important. And then one final area, I guess, that I'll just simply say is to remain as civically engaged as you possibly can. This is an interesting moment in American life where, oddly enough, I wish that folks were a little less engaged. I joke, but nevertheless, I do wish that more folks would actually say, you know, there is a way that I can make a difference. Even right now, the loudest voices I hear from each day, and I am not a mayor from an outstate Missouri part of our wonderful state, but I have a loud group that I hear from each day that says, Lucas, the mask mandate is the worst thing you've ever done. We're very angry. We want it to be done with. And I know that, in fact, Mayor Weir and I had a chat on this a while back, and all types of issues related. Using what you know, using what you see to make sure that the public understands why we do what we do helps amplify the message that good folks like Dr. Archer, Dr. Norman, Dr. Ariola, others are sharing each day. And so I really hope that you all are part of that as we look to the next probably 6 months in our battle with COVID-19.
Thank you. Mayor Alvey.
Well, I would echo what Mayor Lucas just finished with, and I think that there is, unfortunately, the virus has really become politicized in too many ways, and we've made it about our personal rights. We've lost sight of the common good, I think, in this. And what I think is important about medical professionals, doctors, is that you have to focus on the fundamentals. You're only as effective as your ability to focus on the fundamentals of what a disease is, or what a condition is, what an injury is, and break it down to its essential components and say, this is what it is. I'm neutral towards it. I'm simply going to treat the disease. I'm going to, treat the injury. And you can have those conversations about fundamentals with people, and they will listen to you because they're in that situation. And so in our time now, when I look for any group that could really stand out and take leadership over the COVID crisis, I'm really baffled. I think we're at a place where people do not want leadership. I think some people want some people to tell everybody what to do, except when they have to be told what to do. And so we're divided. We're fractured. And so we need to get back down to the fundamentals. From the beginning, the virus hasn't changed. It is what it is. Every time, again, what we knew about it at the beginning gave us reason to fear. What we didn't know about it gave us reason to fear. That's still the case. And what we're beginning to become more aware of is, the original narrative is, well, let's flatten the curve. Well, we achieved that early on in May and June, but because we flattened the curve, then people said, well, it's not a problem anymore. Why don't we relax? So we relaxed, and what happened? We gave this virus the oxygen. It flared up again, and now we're at an elevated plateau. We're coming back indoors. We're setting ourselves for even more uncontrolled spread. That's the fundamental, because the virus is the virus. It continues to be the virus. And what we are finding is that when we focused in on, for instance, the number of deaths as one of those key stats that everybody was focusing on. In fact, I remember being with Dr. Lee, with Governor Kelly, the night we had the first death in Wyandotte County back in March. And so we focused on death. Well, doctors have developed treatments and protocols to reduce the death rate. What we're finding is all of the range of symptoms, from being asymptomatic to death. There's a whole range of conditions that can develop out of this. And as time goes on, doctors are going to be uncovering these things. You need to speak to that, because people need to know you're playing Russian roulette. No, you may not die, but you may develop a very serious long-term condition, and you may not even be symptomatic, but you may pass this to someone else who cannot afford to miss work, develop a long-term condition, and possibly die.
Thank you.
Doctors Focus in on fundamentals, keep doing that, and share that with others.
Okay. Mayor Weir, could you speak to the role for physicians as leaders, please?
I will be quick. I'm going to echo Mayor Lucas. We need you on boards and commissions. You must be a resident of the City of Independence to serve on a board and commission. And we don't find many physicians who are residents of the City of Independence. We have Dr. McCandless, Dr. Potts, and several others. But if you are a resident of the City of Independence, we definitely need you. Medical Reserve Corps, I'm just going to speak very quickly. That's regional, that serves our entire metropolitan area. It's sort of lives at the City of Independence. We kind of adopted them several years ago, and gosh, we had no idea how important that would be, but we need volunteers at our Medical Reserve Corps to help with testing, contact tracing. We very much need, and I'm going to talk for every mayor here, multilingual people. We need people at these testing sites who can talk to these folks in their own language and help explain what what this is all about. We're seeing a real problem with getting multilingual people, bilingual people and multilingual people to help us with that. So if you even speak a little bit of some other language, please, we truly need you. We're going to start piloting our own testing in Independence tomorrow with some CARES Act. We're using some of our CARES Act funding to do testing specifically for people in Independence. And we desperately need folks who can help us bridge some of those communication divides.
Thank you. Mayor Dunn?
Thank you. Well, I have had the privilege of serving on 3 hospital boards, the St. Luke South, Children's Mercy, and currently I'm on Truman Medical Center's board, and have had physician leaders as board members on all 3 of those. Dr. Dries was also on Truman's. They serve such an enormous role in their positions because people look to them for wisdom and counsel, and they bring an expertise that the lay board member does not have. So I have just seen over and over again the value, and can't really imagine a hospital board without physician leadership. So that is one role that I see them, daily, and appreciate them.
Well, thank you. And I would like to just say, it's such a privilege to be part of such a wonderful community. And you as mayors will never get thanked enough for doing the very, very hard work of governing. So my heartfelt appreciation to the 4 of you, and my heartfelt appreciation to my physician colleagues who do incredible work every day. And you are carrying heavy loads, and you do it with professionalism and grace and hope, and we are better together. So with gratitude for the work that my physician colleagues do every single day, I turn it back over to Dr. Dries to wrap us up. Thank you all.